Metal ceramic crown is one of the most widely used fixed restorations. Basically, metal ceramic crowns consist of a metal substructure, means a complete coverage cast metal crown that is veneered with a layer of fused porcelain. So there's a metal substructure, an opacious ceramic layer, and a veneering ceramic layer. The basic principle behind this is a brittle, more cosmetically pleasing material, that is ceramic, is given the support of the stronger metal substructure. With this type of crown, we combine the strength of the metal with the aesthetic qualities of the ceramic. So it's like the best of both worlds, right? Well, not really, because we need to reduce a lot of tooth structure for this type of crown, because you see the dark color of the metal has to be masked. So we need a thick layer of porcelain over it. So the porcelain has to have a certain minimum thickness for aesthetics. To provide sufficient strength, the metal substructure should normally be between 0.3 and 0.7 millimeters thick. Ideally, this should be at least 0.5 millimeters thick with a greater thickness on the occlusal surface. The metal ceramic crown is indicated on teeth that require complete coverage and for which there are significant aesthetic demands, like for example, for anterior teeth. If aesthetics are a priority, an all ceramic crown will be better for the patient, but the metal ceramic crown is more durable and also has superior marginal fit. Since we are talking about metal ceramic crowns in this video, we will talk about all ceramic crowns in another video, so let's stick to our topic for today. Other indications here are similar to those for metal crowns, like extensive tooth destruction as a result of caries, trauma or existing previous restorations, and endodontically treated tooth. Remember the two most important indications here: a tooth that requires a full coverage restoration and need for aesthetics. Contraindications for this are patients with active caries or untreated periodontal disease. Also, in young patients, the pulp chamber is large, so metal ceramic crowns are not indicated, as we just learned. Significant tooth reduction is required with metal ceramic crowns, so there is a risk of pulp exposure. Now let's have a look at the metal alloys that are used in dentistry. Gold alloys, base metal alloys, these are usually alloys of nickel and chromium. Some patients might be allergic to nickel, so these should be avoided in such patients. Third is titanium alloys. Any of these metals can be used for metal ceramic restorations, but their melting point should be above the sintering temperature of the ceramic. If the melting point of the metal and the sintering temperature of the ceramic are too close, then the metal can melt when it is placed in the ceramic furnace. Usually glass ceramics are used for metal ceramic crowns. These ceramics should be thermally compatible with the specific alloys that are used. What does this mean? The coefficient of thermal expansion of the metal should be slightly higher than that of the ceramic. It means that the metal coping should expand slightly more than the overlying ceramic when it is heated. This is the interface between metal and ceramic. You can see how, because of the expansion of metal, this interface is under compression. This is called as compression bonding. This is one of the ways how the metal bonds to the ceramic. Let's see how bonding between these two happens. First mechanism is van der Waal forces. Van der Waal forces are just the forces between the molecules. These forces either attract or repulse, but there is no exchange of electrons between them. So these forces act between the molecules of the metal and the molecules of the ceramic, but there is no exchange of electrons between them. This is one of the mechanisms of bonding between metal and ceramic. Second is mechanical interlocking. The coping surface has small irregularities. Also, it is sandblasted with aluminium oxide to increase the surface area for bonding. So because of these irregularities, micromechanical bonding can occur between the metal and the ceramic. Compression bonding, we just talked about this. It means bonding because of compression on this interface. This happens because the metal expands more than the overlying ceramic. In addition to this, the ceramic shrinks more than the metal when it is sintered and cooled. So it will kind of wrap around the metal like a cling film. Chemical bonding is thought to be the most important mechanism. So the chemical bond is created by partial dissolution of the ceramic at the metal ceramic interface. So what happens here is the porcelain or the ceramic gets saturated with metal oxides. This is how chemical bond is created between the metal and ceramic. Let's have a look at the advantages of metal ceramic crowns. The metal ceramic crown combines the strength of the cast metal with the aesthetics of the ceramic. Natural appearance can be closely matched. Retention is also good because all axial walls are included in the preparation. Disadvantage is that we need to reduce a lot of tooth structure. For better aesthetics, we need to keep the facial margin of the anterior restoration subgingivally. This increases the risk of periodontal disease. Also, the aesthetics are slightly inferior to all ceramic crowns. Another frequent problem is the difficulty of accurate shade selection. So finally, I would like to say that metal ceramic crown may have slightly inferior aesthetics, but they can be used for higher stress situations or on the teeth that would not provide adequate support for an all ceramic restoration.